Ladies and gentlemen, as you are aware, we are in the midst of a crisis. We have recently confirmed reports of cases of a previously unknown pneumonic form of Ebola virus thought to be a novel strain of the Ebola restin virus. There are currently over 30 confirmed cases of this new strain in the D.C. area, and 7 cases in Fairfax County, Virginia, centered around the city of Reston. There are also at least 12 unconfirmed reports in Columbus, Sacramento, Reno, and Denver. Here is what we know so far. On December 15, 2015, Lionel Terrence, aged 45, was admitted to George Washington University Hospital complaining of severe muscle pain and unexplained bruising. Mr. Terrence had been to the D.C. area to visit his mother, Eliza Terrence, aged 63, during the holiday season. It was later determined that Mr. Terrence had contracted a form of Ebola hemorrhagic fever and was promptly quarantined and began treatments. On December 20th, local health department officials served Ms. Terrence a self-monitoring request. On December 27th, 5 students and 2 faculty members of Dogwood Elementary School reported similar symptoms and were later confirmed to have the same form of Ebola hemorrhagic fever Mr. Terrence had contracted. On December 28th, Eliza Terrence reported symptoms consistent with Ebola hemorrhagic fever and was admitted for treatment. By December 29th, the syndromic surveillance was able to confirm that this strain of Ebola virus was in fact a novel variation of the Ebola restin virus capable of infecting humans. It has also been determined that current Ebola vaccines are ineffective in inoculating against the strain. By January 1st, 5 healthcare workers at George Washington University Hospital were put under isolation. Currently, public health officials are locating people who may have had contact with infected persons. Unfortunately, efforts by officials have been complicated by the mnemonic nature of the disease. It is thought that the disease originated in the Covance labs where Mr. Terrence is employed. Mr. Terrence is an animal handler with Covance, working with the laboratory animals employees perform infectious disease research with. While it is unknown whether any handling protocols were violated, it is known that Mr. Terrence was exposed to the virus in the later hours of his shift after several test animals were moved into the main holding area. Efforts are underway to develop a vaccine for this new strain, after which mass immunizations will begin in the United States, with other countries receiving aid as needed. Local health departments have already begun quarantine measures and monitoring protocols for this novel variation. However, given the high rate of transmission, resource-intensive treatments, and lack of any prophylactic measures, there is expected to be a high infection rate worldwide.